I would say first of all that I enjoyed the job very, very much, and I enjoyed working with the staff at the Ministry of Health and Wellness. And for me, those two together meant that I would rate my time here overall as being a very enjoyable one. It has been very, very productive, and I'm glad that a number of things that the Prime Minister had given me or tasked me with, plus some that I wanted to do on my own, that we've been able to do those. Not everything, but quite a bit. I was happy, for example, when we were able to deliver the 24-hour service at Winston Scott Polyclinic, because that was a very, very important event and a very good one for the people of this country. I was equally happy when we were able to bring the close to 100 nurses from Ghana, because we were struggling at that point in time with human resources, and that was a significant boost for us. I was very happy to be able to really dissect what was happening in relation to the nurses and the failure of majority of the nurses at the regional exams, and to be able to get that back on track. So that for me was a very important occasion as well. I was very happy that we were able to complete the accident and emergency department, the new accident and emergency department, although we have not yet officially opened it, because we're doing some additional work there, some expansion, so that we have a larger area for emergency services, and that is going to be achieved by utilizing the space of the old accident and emergency department, plus removing some of the administrative and outpatients clinics and services from that facility to other facilities, so that we will have a larger area to operate with. And I was happy also, I think a high for me was the commencement of the National Cardiology project, which is a game changer in Barbados as soon as we're able to get that ready, finalized. But work has started so that accident and emergency or urgent care centers throughout the island, both private and public, have been trained up the ambulance services of both entities, and we have equipped ours with the necessary equipment to be able to, for accident or emergency management technicians to be able to do a lot of things when they get on the scene where a patient is requiring that sort of assistance. So, and they can also speak to persons at the QEH, consultants and physicians and so on. So that's another game changer. I was happy to be able to get our national NCD program really going. We had some setbacks with COVID, but the National Task Force on Wellness, and we've been able to create a policy, a nutrition policy for school children, and the aim is to make that, or to get that to the level where it is a national program, national policy. And we also have been able to do some things like getting the post of nurse practitioner created, and have persons that are ready for training in collaboration with Ross University School of Medicine and Chamberlain University. And that also is going to be a game changer, because that means that in the future our outstanding nurses will not have to go into administration in order to be promoted, that they will remain there where the skills are most needed. And to give you an example, the outpatient clinics that we have at the moment, and there are 3, those can be managed by nurse practitioners instead of doctors, and that for me is a very, very good thing. And I'm happy also with the work done by the QEH in relation to NCDs and the transitional community program, which sees a number of persons being engaged in community dealing with the worst cases, some of the worst cases, NCD cases, so that they're getting not only treatment and assistance and guidance, but also they're being able to be assisted to the point where that they do not return to the QEH as they used to before on several occasions. So that's a very good thing. I'm also happy that we've been able to really formalize arrangements for non-nationals who've been residing here in some cases for decades, 30, 40 years, and who've been working and paying national insurance, but who were unable to access everything that residents would be able to access, like pharmaceuticals, for example, and certain types of treatment. And so that really was a game changer again, and that I think is a very high point. And I also believe that what we were trying to do in relation to integrating systems within the healthcare community, private and public, because going forward we have to work together. And COVID really is a reality where that is concerned, and that really ought to be the future going forward for Barbados. I was having discussions about running for the City of Bridgetown, and I had discussed this with Dame Billy Miller, because at that time I would have been in my early 40s, and most people, well, tend to enter politics probably a little earlier than that, I believe. There's some who would do so at that sort of age, but I calculated that having spent 26 years or so in the Barbados Defense Force, that I would spend about 15 years in politics. That'd be 41. And I did not want to be doing that into my 60s, because I would have sacrificed. It was a very, very hard sacrifice on family. That's the truth. And my children will tell you that. And then when you reach the point where you have grands, you don't want to go through that same experience too. So that really was the reason, and I had it planned like that. So the first 5 years, regrettably, I spent as the caretaker for the city, for the Barbados Party, because I had lost the election. The second term was in opposition, and this last term, obviously, was serving as a member of cabinet. So that is really what made me decide to go at this time. It had nothing to do with anything that is happening right now. And one of the things that I promised myself was that whenever I was going to leave politics, I did not want it to be at a time when my party had become so unpopular that we end up in opposition, and then a new person had to come to face that, because that's a significant challenge when you're operating in constituencies like the City of Bridgetown. And it is not good for the constituency and the people, and it is not good for the person who is running. And that is the reason why I made that decision. It had nothing to do with COVID and the stress, as people would say, that brought to me. But because, in all honesty, as difficult and challenging as it was and is, I actually enjoy doing it, and I enjoy doing it because this is what duty and service is all about. And it was something that I enjoyed doing on behalf of my country that has given me so much. So it wasn't to do with COVID at all. But the reality, even at this time, and my significant challenge really, was having to deal with this ministry. This is a huge ministry. And for a person like me who had no knowledge or experience, I had to spend the first year and a half learning. And I did learn, because I had staff who really helped me out a lot. And then COVID came. So to have a challenge like this, with the ministry first of all, and then with COVID, and to be responsible for providing for these people of the City of Bridgetown, which, as I said, is a significant challenge given the socio-economic circumstances of the city, my beloved city. It was really that was a challenge, a really big challenge. And even though I was able to operate in the background and provide and do everything I could to provide services and things to meet the needs of the people, the reality is that I have always been a person who's been on the ground and interacting, and that for me was something that I really regretted not being able to do. But my decision was made before I even started, that this is the time that I would have made an exit.